Good morning and welcome to week 4. I know that the past few days have been very trying for some of us, and the elections have brought out a lot of feelings, some of them even traumatic. But I don't want to make any assumptions on anyone's behalf. Just pointing out what I've seen and observed. So what we do as clinicians, as therapists, as social workers is process and examine our own experiences and what's going on within us so that we can better serve the people who come to us. So I just wanted to go over week 4. This week there is also an evaluation, and I look forward to that. I want to know if there's anything else you need from me, if there's some need that I'm not meeting. And I would be very happy to work with you on that. So please do fill out that evaluation as honestly as you can. And if the evaluation does not have something that you want to talk about, please feel free to let me know directly. So this week, we are going to let me go over the objectives and the readings in the media. So essentially, we're now moving into how do we treat trauma. Let me move this. Okay. What we're going to do is, let me back up a little. A few years ago, there was this intense drive around repressed memories, and people gave a lot of importance to that, and unfortunately at times handled it in such a way that it was destructive to the client and their families. So we're looking at memories in a very different context, in a very different way right now. Rothschild chapter right here, chapter 5, talks about first do no harm. Okay, and she talks about bringing the patient to safety before any trauma work can be done. A very simple way of remembering this is if someone is drowning, the first thing you do is throw them a lifeline, pull them in, make sure they're physically okay, give them some warm clothes, give them food, water. You don't start while they're drowning. You don't ask them what happened. How do you get in there? Okay, that part will come much later, and it will come at the client's discretion. So first, our job is to maintain safety, make sure that the patient or the client is strong enough to process what happened to him or her. Okay, so that's what we're going to be talking about in Rothschild. Perry, as usual, comes up with the most wonderful case studies. And so here, this is an interesting one. And again, the question, who's the client? And how important it is for us to stay with our gut feelings. And one more time, he's talking about mirror neurons. He's talking about, and Rothschild is talking about countertransference. You are going to experience some of your clients' emotions. And both these chapters are really great in telling you, what do we do with these emotions? How do we understand them? How do we use them to better listen to our client? And then Van der Kolk in The Body Keeps Score also talks about flashbacks and memories and how a patient is piecing together what happened to her. And almost, to me, it's like helping them solve a puzzle, helping them complete a puzzle. So it's important for us to have distance perspective when we're looking at something. It's also important for the client to be on sure ground, on solid ground before this work begins. I wanted to talk a little bit about your personal experiences. Now, some of you may not have had anything to do with memory so far in either your personal life or your professional life, and you might wonder, how do I integrate this? What do I do with this? It's not important for you to give a very personal experience, but what I want to make sure that, or rather I wanted to make clear that it can be a joyous experience too. It does not have to be traumatic. To give you a very small example, one of the clients I worked with was really scared or started to feel fear when she smelled Johnson's baby shampoo and had no idea. So she went home and called her mom and said, "Hey mom, I'm really scared of this smell." First of all, she had to identify this. This is fear. She didn't even know what it was. So we did some work, stayed in the body, and she said, "I was really scared." And mom said, "Yeah, you hated to have a bath as an infant." And you can imagine this little baby and all the water being poured over her, and then people rubbing her with this stuff, and she hated it. So she did not have a context to this memory. What she did have was this sense of smell, and she had connected it to fear. Okay, so this was an implicit memory, which now became explicit after mom told her. So now she used to smell the shampoo and just smile and realize where this is coming from. So what the readings this week are really, really interesting. Do take a look at them. We have Beth Burrell's article here talking about EMDR, which is again using a different part of your brain to process the memory so that you can observe something without reliving it, without going through it all over again. And so you kind of desensitize yourself to the trauma. And then this is an excellent PowerPoint by Dr. Barb Gillen. And I'm not going to go through the whole thing, but there are really great resources towards the end, the Rothschild videos. And here you have, let me see which one. This one I think is great. Remembering is not required. So there is no need for the client to go through the whole trauma all over again. A lot of clinicians approach it with this idea that unless a person articulates about, what went through in their life, they're not going to be cured. They're not going to be able to overcome this trauma. And that is not necessarily true. Also very useful things on how to stop flashbacks. There is, let me see, it talks about suicidality, but all these are really symptoms of trauma. The person is in distress and they don't know what to do, and so these are really good coping techniques and approaches that you can use when working with client. Let me see where this also I find interesting here, that self-injury is adaptive and life-preserving coping mechanism. So this changes your perspective. They're not doing it to, manipulate, get your attention. There may be another reason for that. And here are some of the reasons: to make me feel real, or to punish me. If I ran out of a burning building but wasn't able to bring my colleagues out of that building, I might feel guilt and shame, and this is one way I would reduce it. To stop me from feeling, to let something bad out. So there's multiple reasons that people might do this, and this is a really great and rich PowerPoint that's going to help you a lot in your career, in your in this course especially. So here are some grounding techniques, and you can use this in your technique demonstration. Okay, so this, because it tells you what the goals are: to reconnect the person to the present, orient the client to the 4 W's: who, where, when, and what. So this is grounding. Okay, and flashback halting protocol also could be used in a technique demonstration. So this is a really great PowerPoint. Let me go back. And then we are going to go to next activity is initial prompt. And here are you have been assigned a letter at the beginning of this course, so you will now check what prompt has been assigned to your letter. Have at least 2 references from the course reading. Headings must be used. Do not summarize the case examples. So don't tell me what is happening, like this boy does this and this and this, and his mom does this and this and this. We know that already. So what is it that you understand by that? You have to take the material one step further and give your personal thoughts on it. Okay. And so here, we've been through this last time, but if anybody is having any difficulty with this, please let me know. Now here, response prompt is read through classmates' posts and complete 4 responses total. These 4 responses must be to classmates who have covered different areas in their initial posts. Okay, so if you have covered, it doesn't matter what your topic was, but when you respond, make sure you're responding to 1 micro, 1 meso, 1 macro, and 1 therapeutic approaches, so that you approach the case through 4 dimensions. Okay, that's the idea behind these 4 responses. I'm going to go to the next one. This is there. Now, when someone posts a technique demonstration, you have to respond to that, people, and you have to talk about what you thought, what you felt. So these are responses, and then they have 6 points. So you have to complete the responses by Sunday. They should reflect original comments, include supporting evidence from professional practice or readings. Word count is within required limits per directions, and of course grammar and punctuation. Okay, now I'm letting this week 2's thing go. We have 2 techniques already, one from Kyle, one from Carol. Please respond to them following a sufficient response should be 75 words minimum, maximum 150, and then what you have to do is give an example of how this has resonated with you and what train of ideas or thoughts has started for you. Okay, and then we come to the triad diet check-in. I have already assigned you to groups. You should be able to communicate with your group member regarding your population and the end of semester presentation that you guys are going to set up. So if anybody's having difficulty with this, again, let me know, but you have been set up in dyads. All right, let me see. I think I'm going into areas you're not supposed to see, so let me go to this one. Other than this, if you have, I think we have covered most of the stuff. We have 3 more weeks to go, 4 if you count this week as well. I'm noticing, and I'll make this very brief, I'm noticing that some of you have some issues with what is expected in a journal discussion or what is expected from you as a personal response. I wouldn't worry too much about it. Don't overthink it. I think trauma is very normal in the sense that none of us is trauma free. And so I feel it's a good way to read something and think about it, and think about people close to you, could be your clients, family members, friends who have experienced something like that, and try and analyze their behavior. Why do you think this happened? And it could, again, does not have to be traumatic, and you certainly do not have to disclose it. But it will give you like an in vivo example and help you integrate the learnings. Okay. So good luck with week 4. And if you have any questions or any concerns, please let me know. Okay? Thank you.